CPR for babies and kids, what every parent should know. First off, this video is just for education, okay? It's not a substitute for certified CPR training. Please, if there's anything you can take from this, it is to take a class on CPR Basics at the very least. Please take a class if you can, because you might save a life, okay? Next, CPR done incorrectly can cause harm. So if you don't know how to do CPR, do not do these steps that I'm telling you. You focus on calling 911 and you focus on getting help. Okay? Comprende? Good. Let's move on. Look, in a real life emergency, just having basic knowledge can save a life. Go to a class, have this basic knowledge. I'm a firm believer that every parent should understand the basics. When a child's heart stops, oxygen stops reaching the brain, right? And within minutes, this can cause permanent brain injury or death. That's why taking action, even if it's just chest compressions, douche, 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 can make all the difference before help arrives. Let's talk about infants under 1 year old. Lay them on a flat surface. Use 2 fingers in the center of the chest, just below the nipple line. Push down about 1.5 inches at a steady rate of 100 to 120 beats per minute. See, I can say that, but you learn what that feels like at a class, at a course where you're coached properly, which is what I recommend, okay? Why are we doing this? We're acting as the heart. We're pumping oxygenated blood to the brain and the organs, okay? Let's talk about children, 1 year and older. Use 1 or 2 hands in the center of the chest. It's a judgment call. Kid size, your form, where they are, it's a judgment call. Do your best. Push about 2 inches deep, okay, at 100 to 120 compressions per minute. See the pattern here? Okay, why are we doing this? Most cardiac arrests in kids are caused often by breathing issues, asthma, things like this, okay? Chest compressions help keep oxygen moving while you wait for help, okay? That's the most important part to this. What about rescue breaths, okay? For adults, compression-only CPR is often enough early on, okay? The lungs were working until the heart stopped, okay? But with kids, it might be a different situation. Their heart often stops because maybe they just couldn't breathe. That's why rescue breaths matter more for infants and children. Well, really, they matter for everybody, but you know what I mean? They really matter more for infants and children because their issue may be respiratory related. Who knows? But only do this if you are trained and have a barrier device. You can order those online, okay? Want to be extra prepared? You can buy CPR face shields or masks, those pocket masks, online. They're small, they're affordable, and designed for safe rescue breathing. If you take a class, they'll show you how to use one. I highly recommend you take the class before you use one of these things, okay? If you're not trained, don't do it. Look, and most importantly, if you can't remember anything, just do chest compressions, okay? Push hard and fast in the center of that chest. No breaths, no pauses, just freaking go, all right? Why are we doing this? Again, even compressions alone buy time, keeping blood and some oxygen moving until help arrives. What's the final takeaway of this? Take a certified CPR class. I think you know that by now, especially if you're a parent. Please do this. You'll learn how to respond with confidence and give your child their best shot. If unthinkable happens, you got this, all right? Follow for more life-saving first aid tips every parent should know. Please like and subscribe. Dr. Merchant out.